I'm Andrea Klein-Thomas here, a reporter from CBS New York, here at the 5th International Vatican Conference. I'm joined right now by Alan Karp. Alan, thanks so much for being here.
Oh, you're welcome, Andrea.
As you know, this conference has so many stakeholders right here at the table. Why do you think it's really important to have these discussions, especially right now?
Well, I think by focusing on the whole person, we really start to get to the root cause of some of the problems in the healthcare delivery system. For example, there are social issues that drive health status and cost of patients. There is mental health issues. So by focusing on all of those things, I think we get a better idea of how can we not only improve the health status of anyone who uses a healthcare delivery system in the United States, but also lower the cost of care and provide the right care at the right time at the right place.
Right. How important do you feel value-based care in healthcare will become?
I think it's incredibly important, Andrea. It focuses on all the right things: quality of healthcare, the affordability of healthcare, which has been an issue, as we know, and also the experience that person has in the healthcare delivery system. It's a very difficult system to navigate, and by being able to coordinate care, I think the patient will benefit tremendously. I also think by focusing on quality and cost as opposed to the fee-for-service reimbursement system that's in place today in most of the United States, will really get to better outcomes at lower cost.
Now, that all sounds good, but we know it's easier said than done. So, what are some of
Yes.
the obstacles, three obstacles you think that uh, the system will face in trying to implement that value-based care?
Yeah, I think the first one is getting all sides of the healthcare delivery system to talk about the best ways to treat those patients. So, for example, for us, we had many conversations with the leadership of Hackensack Meridian, for example, before we entered into our partnership to make sure we were aligned, to make sure we thought of the best ways to handle our members and their patients. And so I think establishing that trust is important in making sure that everybody understands where we're going. I think the second thing is alignment of incentives. Under a fee-for-service system, the incentive is the more patients you see, the more you get paid. But by creating a value-based system, it's based first on the quality of care that patient gets, and then providing the right service at the right time. So there's an affordability component, but by providing information and insights to physicians and getting them to understand that there's another way to tackle this problem that benefits them and the patients, I think is important. And then I think the third thing is data sharing and getting over those barriers of transparency. So, for example, we have information like pharmacy data or where a patient's going to see a specialist that the health systems may not have. They have information on their own patients, but after that, they don't see that information. So by bringing that together and sharing that information and using analytics to provide insights, we're going to have a much better opportunity to treat those patients and our members going forward.
Yeah, that collaboration is definitely so key to all of this and really transforming the healthcare system. Thank you for all
Yes,
you're doing to that end, Alan. Thank you so much
right.
for joining us.
Thank you.